Want to welcome everybody to the session today. We're really excited to share some of our recent work with you and to talk about ways that we can use this work as a starting point for improving children's mental health care in Hennepin County. Our topic for this session is what we know and don't know about children's mental health in Hennepin County, which is, of course, a very big topic, and we can't do it justice in 20 minutes. But we want to try to share some highlights about things that we have compiled about family and youth experience in the county, and we're going to use that as that kind of foundation before we go into the breakout sessions, where hopefully we will be able to jump in and start thinking about solutions and opportunities for how we can strengthen our system and better serve families. So Pat mentioned briefly the system of care model, and I want to talk about it just very briefly because it's a frame for the work that we're doing today. In 2021, the collaborative began a planning process to try to move towards a system of care approach. Systems of care have a long history, and you may be familiar with the nearly 30 years worth of work being done federally on this framework through the Substance Abuse and Mental Health Services Administration. We are not receiving federal or state funding for this initiative, but we are working to implement the framework. Fundamentally, the system of care approach is a set of guiding values that shape the way that services are provided to children, youth, and families. In a system of care, children receive services in the least restrictive settings, and those services should be comprehensive and coordinated and individualized to meet the child and family needs. A system of care approach requires a significant shift in how decisions are made, including not only decisions at an individual child or family level, but also system level decisions. At all levels, decisions should be centered in family voices, grounded in health equity and cultural humility, and driven by data. This event is being organized in that spirit. As the Children's Mental Health Collaborative embarks on this next phase of our system reform efforts, we want to bring partners together in an inclusive way to discuss ideas. And we want to start with a shared understanding of what parents have told us about their experiences and what other data tell us about children's mental health in the county. I'm going to share some of this background information during this session just to provide a starting point for the work that we'll be doing in our breakouts. The information that I'm going to share this morning comes from two recent collaborative efforts. First, I'm going to talk briefly about our efforts to create a dashboard of community data regarding children's mental health. And we're also going to share some highlights from these recent interviews that we completed that Pat referenced. We used an approach called journey mapping to explore parents' experiences moving into the children's mental health system. And in this project, we interviewed 49 parents about their experiences entering children's mental health. We're going to start with the dashboard, though. Our goal for the dashboard was to compile available information from a variety of federal, state, and local sources about child well-being. Sample information sources include community surveys like the Minnesota Student Survey, county level service data, and other information. Our goal for the dashboard was to pull data together so that we could monitor trends, use the data to prioritize service and system reforms, and to align our system of care efforts with these broader system goals. We are currently creating a portal to access the dashboard data through the collaborative website. The dashboard is organized by topic. Sections are currently completed related to topics such as youth economic well-being, youth mental health, adverse childhood experiences, and community engagement. And there are other sections that are in progress that we will be adding to the dashboard over time. While we will share some highlights from the dashboard this morning, unfortunately, relying solely on these kinds of public information brings us to the what we don't know portion of the opening session. While we want to start with information that's readily available, there are significant limitations in relying only on this information. For example, we generally don't have access to real-time information. Sometimes there's a delay in information being released, or sometimes it's only collected periodically. For instance, the most recent Minnesota student survey data that we have is from 2019. In many ways, our world is a very different place for our youth than it was in 2019. And we can speculate from other information sources how our children and youth have been significantly impacted by recent events like the pandemic and community violence, but it's going to take a while before we see that reflected in these data sources. So a dashboard often gives us a retrospective picture of trends, but it doesn't give us that early warning of issues that may be emerging. Another significant issue is the limited information that many data sources have related to disparities and equity. Information is not always tracked or released in ways that let us see variability and well-being by race or ethnicity, by gender or gender identity, by geography, sexual orientation, or other things that we know can impact not only individual and community well-being, but people's experiences with services. When data are shared, they typically only highlight disparities or places where the data varies by subgroup. It doesn't tell us why there are differences or to really deeply inform strategies to promote health equity. Finally, not all information that's collected is shared in meaningful ways. Individual agencies and systems often collect their own information, but they do it in their own ways. It's very difficult to get a big picture understanding of things this way. For example, we often can get information about services provided to youth under public insurance plans like MA, but we don't have this kind of information for youth with private insurance. That being said, there's some really important questions that we have about children in Hennepin County that we can't answer with our dashboard. We don't know how youth are first identified as having potential mental health concerns. We don't know what percentage of those youth or families eventually connect with some form of mental health support or whether they got good support. We know very little about how parents experience those services in terms of satisfaction or their perceptions that those services aligned with cultural values. One goal for the collaborative, although not what we're going to be talking about today, is to bring stakeholders together and to talk about ways that we can better answer these collective questions by working together to share information in more meaningful ways. We do know some things, however, and we'll highlight just a few quick items today from the dashboard. First, as of the 2019 Minnesota student survey, we know that about 1 in 5 ninth grade students self-identify as having a long-term mental health, behavioral, or emotional problem. That figure has remained pretty stable over time, although again, it might look different when newer information comes out later this year. We also know that overall finding hides significant variation in self-reported mental health by student race or ethnicity. In the student survey results, for instance, white students and multiracial students are much more likely to self-report that they have mental health issues compared to students from other racial or ethnic backgrounds. There's also significant gender differences that emerge consistently over time, with females being much more likely to say that they have mental health concerns as compared to males. While this information is a little older, from 2015, we also have some information about what parents say from the Hennepin County SHAPE survey. In this survey, about 10% of parents said that their child had long-term mental health issues. The same percentage say that a professional, such as a doctor or a teacher, told them that their child needed professional help for an emotional or a behavioral problem. The percentage of parents who say that their child has mental health issues tends to increase as children get older. And we also see some differences by family income level, with parents at lower income levels being more likely to report mental health issues than parents at higher income levels. This information is a good start, but again, it often raises more questions than it answers. What happened to these children and parents who identified a mental health issue? Did they get what they needed? To ground our decisions in parent voice, we decided last year to embark on a project to interview parents about their experiences entering mental health system. We wanted to know how and where they entered the system and what their experiences were finding services. We wanted to know what worked well for them in that process, what challenges they faced, and what support they received in finding and accessing support. We conducted outreach to parents through a variety of sources and distributed recruitment flyers in multiple languages with a goal of reaching as many families as we could. Our flyers let parents know that we wanted to talk especially to parents who had entered the system within the last 5 years or so. Parents who were interested signed up for one-on-one interviews. They took about 45 minutes to complete, and all parents who were interviewed received a gift card. We ended up interviewing 49 parents. Geographically, they came from different places across the county, and they shared very diverse stories about how they first identified that their child had a mental health concern. Some children were identified when they were very young. Others were in high school. Often the parents were the first to recognize that there was a concern, but some of the children were identified by teachers or by doctors or through a screening process. The full report from the project shares some vignettes related to these entry points and briefly tells some of the stories about how parents identified their children had an issue. And eventually, many of these children ended up being diagnosed with things like anxiety or mood disorders, attention deficit disorder, autism spectrum disorders, and other conditions. Almost everybody who signed up for doing an interview was female, but we talked to a few fathers as part of the process. About 80% of the parents, but only 66% of their children with the mental health issue that they were talking about identified as white. 8% of the parents each identified as Black and American Indian. A few parents identified as Asian or Hispanic. We talk about this more in the full report in the summary, but we had hoped to have more representation of BIPOC families in the interviews. And if you read the report in the summary, you'll see that we supplemented interview results with other published information about behavioral health equity and inclusion. But we are still looking at additional opportunities to ensure that our planning really represents the perspectives of all county families. We asked these parents what kind of services they looked for their child. All of the parents that we interviewed tried to get a diagnostic assessment for their child. Most tried to find mental health services, and most tried to find educational supports like an IEP or a Section 504 plan through the schools. Most also looked for community-based programs to support their child's mental health, like sports programs, mentoring, or arts programs. 2/3 of them looked for medication options for their child, and 41% looked for other kinds of healing services like nutritionists or herbalists or cultural healers or other services like that that were designed to be healing, but were not Western mental health services. Now, if the system was functioning optimally, these parents would have had a pretty easy time navigating care. They would have identified a potential need and then quickly received a diagnostic assessment if desired. That assessment would give them the information that they needed to look for services that aligned with their child's needs. And they would then easily be able to find mental health support, educational supports, other healing services, community-based programs, and medication. However, it ended up being much more complicated. And this is a diagram of parents' actual journeys through the mental health system. We're not going to go through the visual detail today, but I just wanted you to see the complexity of it. Parents' journeys were often characterized by challenges figuring out where to go, long waiting lists, and closed doors. The visual is included in the report and it's in the summary if you'd like to see the steps in more detail. We asked about experiences with each of those kinds of services. The full report and the summary provide more information about each of those types of services, and I'd encourage you to look at those documents. The documents also include a lot of quotes from parents to kind of bring those stories to life. For today, I'm just going to briefly mention 6 top themes that emerged from the interviews. First, parents found the children's mental health system very difficult to understand and access. Parents often did significant amounts of research on their own to try to find services, and they needed to go to lots of different internet sites to try to get information. Services were siloed, which made it hard to see the full array of supports that were available. For instance, children who were served in a healthcare setting often had better access to medication, but they may not have had assistance understanding options for educational support. While almost all parents talked about this as a challenge, Some felt that it was easier when they had greater resources available, like more flexible time or professional backgrounds that helped them understand the system or the terminology that was being used. Second, parents talked a lot about their own stress and anxiety. Many described feeling overwhelmed and anxious when trying to look for services. They also felt the impact of stigma, which resulted in them feeling shame or guilt about what was going on in their family, and it made it harder for them to look for help from others. They also talked about providers who didn't seem very interested in how they or other family members were doing. Third, it made a big difference when somebody helped them navigate the system. While most parents did not have this kind of support, some parents had access to a case manager or a system navigator who helped them find and get into programs. A few parents identified other professionals who do not normally serve as navigators, like teachers or doctors, who gave them insider knowledge that helped them identify and access care. Fourth, parents greatly valued support from their peers. When they first identified that their child had a potential mental health issue, many of the parents first turned to their own friends and family members for support. But it became increasingly important to many of them that they connect with other parents of children with mental health needs. They found that those parents not only understood what was going on and provided them with more emotional support, but they also had more ideas about services or suggestions for reducing access barriers. Sometimes parents joined Facebook groups or support groups. Others talked about meeting other parents in waiting rooms at provider agencies or in hospitals and building those relationships. Fifth, finding services did not necessarily mean that they could get into them. Across the continuum of care, parents faced long waiting lists and programs that were simply not accepting new clients. They found it especially hard to find programs willing to accept children who may have more complex or unique needs, like cognitive delays or histories of aggression, for example. And finally, many parents described needing to constantly advocate and fight for their child. Rather than working in partnership with providers, they described feeling invalidated and unsupported. They also described needing to feel like they were constantly confronting and challenging providers and systems to try to meet their child's needs, and that they were often working in opposition to people that were trying to block them from getting care. So that paints a fairly discouraging picture of parents' experiences, but they did have recommendations for how we can improve the children's mental health system. And that's ultimately what we want to focus on today with our breakout groups, is how can we make this better? How can we make sure that parents and families are able to quickly identify and access the right kinds of care for their kids? Three of the top recommendations that came out from the interviews, we did ask parents specifically what could be done, what are the recommendations that they had for how they could be better supported. Three of those top recommendations focused on making it easier for parents to find and access services for their children, including building awareness of mental health services, increasing access to peer support, and offering navigators to help facilitate that access to services. Another top recommendation from parents related to encouraging professionals to listen and validate their concerns. In other words, using more family-driven care models. We will explore these 4 recommendations further in the breakout sessions that will be coming after the Q&A. That summarizes the background data that we wanted to share, but we have we built in some time here for questions. And I'm going to